I know some of you may be wondering what's happening in the above video, but basically it's traditional massage in pregnancy. As a result, I'm going to be talking about complications of traditional massage in pregnancy. So let's go straight to the complications. 1, it causes miscarriages. 2, preterm labor and delivery. 3, abruptio placenta. 4, it complicates placenta previa. 5, it increases the rate of cesarean section. 6, causes pulmonary embolism. 7, it increases maternal death. And then 8, perinatal death. For the purpose of this discussion, I will just limit the complications to the above 8 points, and I'll be explaining each and every one of those complications. For miscarriages, basically it's self-explanatory, causes early pregnancy losses, and that's why most authorities will advise no massage, especially in the first trimester, which is the first 3 months of pregnancy. For preterm labor, these increases the chances of admission of preterm babies into the special care units, increases cost of treatment, and even burden, and also this leads to perinatal deaths for them. Abruptio placenta basically is explained as the detachment of the placenta from its attachment, which is usually a normal location, and this leads to bleeding. The baby can die in the process, and severe bleeding can also affect the mother, and the mother can die in the process. Yes, cesarean section rates are increased when this occurs, as those complications I mentioned above, which are associated with bleeding, can necessitate the need for emergency cesarean section. For patients who ab initio may not have such a risk factor. Pulmonary embolism basically is when there's a dislodgement of clots. Even in patients who do not have the risk factor for pulmonary embolism, like deep vein thrombosis, it has been shown to occur in these patients. For maternal deaths and perinatal deaths, these are consequences of some of these complications we mentioned, like the bleeding per vaginum as a result of placenta detachment, or as a result of complication of placenta previa, which is basically a placenta that is located down there in the lower segment of the womb or the uterus, and then with rigorous massage side to side and front to back and all that, this can irritate the placenta, causing severe bleeding that may also lead to these complications we've mentioned. I think this does not worth the stress of going through this massage, and as a result, just avoid the belly in general when it comes to massage. However, I would like to state at this point that there may be therapeutic need for a procedure called external cephalic version, which is properly done in the hospital to prevent some of these complications and to intervene as early as possible if necessary. Stay tuned and glued. I Dr. Hart. We'll be right back. Respect.